A pleasant day to everyone. I am Maureen Acriche, and I will be presenting my research paper entitled Impact of COVID-19 Disease on Orthopedic Service from May 1, 2019 to June 30, 2019 versus May 1, 2020 to June 30, 2020. To introduce my study, COVID-19, as we know, affects the respiratory system. This was first identified in December 2019 in Wuhan, China, and barely a month after the cases started, the World Health Organization acknowledged it as a public health emergency. After the first case was confirmed and isolated in the Philippines, the private and public sector collaborated and an interagency task force on emerging infectious diseases was created. The DOH then issued a memorandum that was directed to all healthcare institutions, both public and private funded, where strategic measures were mandated. This included the reorganization of the staff, increasing intensive bed capacity, and additional health protocols to avoid spread of the virus. In significance of this study, this would provide data on the observed trends in the pandemic, and with these, our institution will be able to establish and implement sustainable guidelines while maintaining optimum safety. Now, our research question is, what is the impact of COVID-19 on orthopedic healthcare delivery? General objective is to determine the impact of COVID-19 on orthopedic healthcare delivery, and specific objectives are as follows. 1, to identify the demographic profile of patients according to the following: age, gender, location of the orthopedic problem, and 2, to compare the periods of May 1 to June 30, 2019, and May 1 to June 30, 2020 in terms of the following: top 5 types of surgeries, total number of emergency surgeries, total number of elective surgeries, number of orthopedic surgeries per day, and average turnaround time between surgeries. Now to proceed with the methodology. Study design is a cross-sectional operating review, design of the logbook, and the study setting is in Vicente Soto Memorial Medical Center. Sampling technique includes total enumeration of all patients logged in the operating room surgical logbook on May 1, 2019 to June 30, 2019, and May 1, 2020 to June 30, 2020. Includes all the surgeries logged in that particular time frame and excludes records with incomplete details. Data is collected, which includes the coded name, age, gender, date of surgery, diagnosis, location of the orthopedic problem, and the turnaround time between surgeries, and was subsequently encoded in Microsoft Word and Excel 365 Pro Plus. Demographic data was expressed in its absolute value, frequency, and corresponding percentage, while turnaround time was described using the mean and standard deviation. Results are as follows. Table 1 shows the age distribution in the study population and are observed to be comparable or statistically the same. In both years, more adults were enrolled than pediatric patients. Table 2 shows the gender distribution of patients, and in both years, more male patients were enrolled. Table 3 shows the anatomic location distribution. In both years, the largest proportion of patients were lower extremity anatomic location. Table 4 shows the top 5 types of surgeries from both years. The top 5 from May to June 2019 include the following in order: debridement, or if application of ankle spanning external fixator, and next are draws between several surgery types. The top 5 from May to June 2020 included the following in order: debridement, or if below knee amputation, open reduction, and next a draw between different surgery types. Table 5 shows a comparative analysis of the number of surgeries and the average turnaround time between both years. The number of orthopedic surgeries per day were statistically the same. However, there was an increase in the number of emergency surgeries during the pandemic and a longer turnaround time between surgeries as well. For the discussion, the study showed the trends that were observed during the COVID pandemic, especially in orthopedic care. 2 time periods were taken into account prior to the pandemic and during the start of the pandemic. In the study, majority were adult, male patients sustaining injuries in the lower extremity. Debridement was still the top 1 surgery and ORIF was top 2, indicating that even with the pandemic, patients still sustained a multitude of injuries which prompted surgery. There was an increase in the number of emergency surgeries during the pandemic because all elective surgeries were put on hold and only emergency cases were catered to. A longer turnaround time was also noted with a p-value of 0.001 during the pandemic. This demonstrates that hospital protocol introduced several COVID measures aimed at avoiding cross-contamination and sanitation between procedures. All these changes were also synonymous with orthopedic care in the different regions of the world, such as the UK and Romania, where the orthopedic sector was also heavily hit by the pandemic. To conclude the study, COVID-19 pandemic affected the delivery of orthopedic care. Even with the suspension of all non-essential activities and a shift to home-based scheme activities, people still sustained injuries which required surgical intervention. As we adapted to the new normal routine in orthopedic care, changes were made to protect both the patient and healthcare workers, which was because of strict traffic control in the operating room, strict sterilization, and sanitation as well. Recommendation includes further studies that would focus on orthopedic surgery in terms of the following: outpatient services and follow-ups during the pandemic. Further studies would also include at 1 to 2 years after the pandemic began, enough to have had the medical field implement and adapt to changes. Thank you and have a good day.